So it's my pleasure to be with you. My name is Laura Lamb, President and CEO of Episcopal Retirement Services. And I tell you, I got up this morning so excited to be with 5 amazing women that have taken an hour out of their day to be with us. And I just feel like we at ERS are so grateful to have such a talented and experienced panel with us. And so I'll thank the panelists in a minute, but I'm just so excited about learning together and hearing the latest information from our panelists. So I just wanted to start with some context. First of all, if I start rubbing my shoulder, many of you haven't seen me since my surgery. So I had rotator cuff surgery about a week ago, and I'm doing well. I've got my sling, obeying all the hospital and doctor protocols, but just every once in a while, I find myself just rubbing it. So if you see that, that's what it is. It's probably time for another dose of Tylenol. The other thing I'd like to just say is that we are here together because we deeply care about our staff. You know, it's really who we are as Episcopal Retirement Services, is that we are in deep, meaningful relationships with our coworkers and our residents. And as our team together here today, we care about each of you, and we care very much about where each of us are on this journey about on the COVID vaccine. And we recognize that everyone's at a different point, and we respect that. And as an organization, we've decided to make vaccination mandated, and we're really excited that organization-wide our percentages are really, really high. But candidly, for those of us that are here, which we all are, to serve our residents, we believe that the safest environment for the most vulnerable in our care and service, the best environment, is a fully vaccinated environment. So we believe that we can do multiple things simultaneously. We care deeply about people, respect their individual decision-making process, but that we have to make a decision for ERS. So that's what we've done. And we're committed to that. And we're also committed to providing education to all of our staff. So that's why we're here. We've been talking about the vaccine since January, when it was available in all of our communities. And we wanted to make sure that you had access to industry leaders. And that's why we reached out to the very best in our areas, the very best healthcare providers, to be with you today so that they can share their experience and their knowledge, so that you're not just hearing it from us, you're hearing it from other folks that care deeply about healthcare workers and society in general when it comes to our vaccination. So we are recording today's session. We're recording that primarily for meeting minute purposes, but just wanted to make sure that you see that. As far as logistics go, many of us had access to a really good NPR report just recently that talked about vaccination hesitancy, and it really highlighted 4 reasons that folks are hesitant about the vaccine. And so we thought that that was a good framework to use for our panel today. Additionally, Joan and myself and other members of the servant leadership team have met with lots of our staff that have yet have not taken the vaccine, and talked to them about why they personally were not taking the vaccine or were hesitant about that. And we took those categories, broad categories, and structured your questions in that format. And our panelists have particular interests and experience, and so we've asked them to respond to a series of questions. So each panelist will have 3 questions, and then after we've gone through all of the questions, we'll open it up for you to ask your questions. So we think a lot of the questions will be answered with the opening questions, but if not, this is your meeting, and I encourage you to use the chat feature and chat with Joan Wetzel, our moderator of the panel, and she can ask those at the end of our panelist discussion. So without further ado, let's get started. We have 5 amazing women on the call. I'm really proud that there are 5 amazing women. Go women. I love that. And they're leaders in their industry and in their subject. And that is really exciting as well. So I'd just like to thank the 5 panelists that are with us. Dr. Melba Moore, many of you recognize Melba. She's on the news, leading Cincinnati in such a positive direction when it comes to health outcomes. And Dr. Moore is with us today as the health commissioner and just a wonderful leader in our community. We're also joined by Felicia Beckham. Many of you might recognize Felicia. Why don't you wave, Felicia? Felicia actually worked with us at ERS a number of years ago when we were starting our NP program, and it was really fun to reconnect with Felicia and get to know what she was doing in the community. We also have Renee McGaffey Harris with us she's the president and CEO of the Center for Closing the Health Gap. And, there's very few people in the city that have done such good work in identifying and helping us with racial inequities in healthcare. And I'm just so excited to hear her remarks today. Then we have Dr. Lou Edgy, who is really become the wonderful face of vaccination with UC Health and just a number of organizations. So I just am so impressed with what I've read and heard about Dr. Edgy, and it's so nice to have her with us. And last but not least, we have Dr. Renita Usher, who's with us from our very own Episcopal Church home as our NP that works with our residents day and day, but also in the U of L geriatric family practice division. So like I said, this is a great panel to really share a unique perspective with all of us. So without further ado, I'm going to hand it over to my partner, Joan Wetzel, to kick off the panelists.
Great, Laura, thank you. So everyone, it's so nice to be with you. I did just want to mention, I know some of you are in a room together. And so if you have questions, there should be someone in your room with a computer. So please share your question with them and they can get that question over to me. So we're just really going to go in order through those categories that Laura just spoke about. So we're going to start with safety and medical. And Dr. Edgy, this first question I'm going to ask to you. So we've heard a lot from the CDC and from our departments of health that the vaccine is safe and that it's highly effective. But as of last week, the FDA didn't approve any of them until they approved the Pfizer vaccine. So without the Moderna and the J&J vaccine being fully approved by the FDA, this has caused some hesitancy. Wondering if you can speak to that.
Absolutely. Thank you for having me. So a couple of things. I just want to look at overall what FDA approval means. There are 4 major buckets. First of all, it's the preclinical phase where they go ahead and test the drug that was developed on animals, and just to try and make sure that it's not toxic. Then they go ahead into the clinical phase, and then they go ahead in that phase, test people in increasing numbers, mainly checking for the safety and then also how effective it is. And they start off, with 20 to 80 people, then they get into the 100s. And by the time they get to phase 3, you're into the thousands of people being checked with this. Then the third part is to go ahead and get what we call an NDA, which really is a new drug application submitted to the FDA. And they go ahead and take a look at, the location that the drugs are being made. They look at all this data. For Pfizer, they actually looked at 340,000 pages of research, both animal studies, human studies, and everything else to get to the point of this FDA approval. We fully expect that Moderna, who has already applied for the same thing, will get approved here in the next few weeks. And so we'll have 2 drugs that are fully FDA approved. And J&J will not be far behind. We're expecting that to be within the next month and a half or so.
Great, thank you. Really appreciate that thorough explanation. I learned a lot during that. Thank you. Dr. Moore, this next question is for you. we've been hearing a lot about needing a booster lately, that might be needed in addition to our original dose of the vaccine. Does this mean that the vaccine isn't as effective as maybe we originally thought that it was, or that it will extend the efficacy of the vaccine? Can you please speak to that?
Certainly. Good afternoon, everyone. And I first want to just say thank you. Thank you to all of you who have received your initial dose of vaccine, whether it's first, second dose. I really appreciate it. And I think we haven't had enough time to say, just thank you. Thank you for that. The other piece to that, beyond that thank you, is to say to those who haven't quite made a decision, we're still here. We're here. Any questions that you have, we're ready to answer those questions and to be here for you to kind of ease you into understanding the significance of this. You hear so much, and we're here for that. As it relates to the booster, number one, there will be plenty of vaccine for that. Number two, it does not mean that the vaccine is not effective. The vaccine is still remarkably effective in reducing the risk of severe disease, hospitalizations, and death. And I see this booster as an extension of what we've received when we received our first and second dose. So I highly encourage everyone here that as you move through this process, as we move through this process, know that the boosters will be available, and you'll see similar situations that you saw and opportunities that you saw early on with the vaccine, those large community sites. What we're waiting on now is the final guidance that's going to be issued by the Advisory Committee on Immunization Practices, ACIP. We're waiting on those final recommendations, guidance as it relates to, will we receive the, and I think I'm gonna look to Dr. Edgy here, will we receive this booster 6 or 8 months after the second dose? There's been a lot of discussion around that. So we're gonna keep our eyes on it, be available, stand ready, and just open our arms to anyone that wants to get their vaccine when they're ready, after having that discussion. Thank you.
Thank you. And Dr. Edgy, actually, my next question is for you. So if you want to expand on the previous question as well during that, that would be great. Are there any medical conditions that would prevent someone from getting the COVID-19 vaccine?
So thank you. So just going on with Dr. Moore's comments regarding whether it will be 6 months or 8 months after, we're not quite sure. We'll wait and see, but it's actually looking like it might actually be 6 months. So far out in the news, it's been 8, but the ACIP really will go ahead and come out hopefully in the next week and a half or so with their recommendations. I don't think it makes a very significant difference between the two. Just as long as you make sure that you're getting your follow-up done. I think that's the main thing. As far as the other portion of your question, I think there are only really 2 situations where you shouldn't get your vaccine. One, if you've actually had a severe allergic reaction to an injectable medication, or if you're allergic to any of the parts of or the ingredients of any of the vaccines. And just to bring that up, the 3 main ingredients in the mRNA vaccines are mRNA, which really stays in your body for just about 48 hours, like a Snapchat message, just enough to get the body to wake up and make its antibodies, and then it's gone. So if you have any side effects from mRNA, it's usually going to last just the 48 hours. The second ingredient in those vaccines, which would be Moderna and Pfizer, is sugar. And the third is a nanoparticle, which is just a little bit of fat that keeps the mRNA nice and stable to be able to be injected. So there are only 3 main ingredients in the mRNA vaccines.
Okay, wonderful. Thank you. Thank you. Dr. Usher, I have a question for you. If, and Dr. Edgy just spoke about this a little bit, but this question's a little different. So we've heard a lot of people talk about having a negative reaction to the flu vaccine, maybe an itchy arm or not feeling great the next day. If someone's had a reaction previously to the flu vaccine, are they likely to have a reaction to the COVID-19 vaccine as well?
I want to first thank ERS for allowing me to participate in such a needed conversation for not only our staff, but for the community also. I want to touch base on the flu vaccine. So if you're allergic to the flu vaccine, so say someone's allergic to eggs, eggs are not a component that's in the COVID vaccination. So that's one thing. If you have a severe reaction such as Guillain-Barré or Guillain-Barré, as some would call it, that's where your own immune system attacks your body. Then you should seek advice from your PCP, primary care physician, or an allergist. Or if you have a severe reaction, such as an anaphylactic reaction, you want to first seek recommendations from your PCP or an allergist. But you're going to have a localized reaction. Most people have a localized reaction from most immunizations. So you may have a sore arm, there may be a little redness, you may have a low grade temp, things like that. Those are what we consider minor reactions. Major reactions would be things like shortness of breath, racing heart rate, a temperature that can't be controlled by something like Tylenol or ibuprofen, things like that.
Wonderful, thank you. You know, Dr. Usher, if we could just stay with you, you've really committed your career to working with elders, which so many of us here on this Zoom today can relate with, and working at ERS. Have you seen, you've just really seen the impact over the past 18, 19 months now of how this virus has impacted elders versus the general public. I'm wondering if you can just tell us about that experience and how that's really impacted you personally.
Well, first of all, I tell everybody in my story, I started from the beginning of life in nursing. I was a labor and delivery neonatal nurse, and I've transitioned toward the end of life, so to speak. But I think I found my niche in geriatrics. I love working with older people. They have a wealth of knowledge. The conversation is different with every visit. So it's truly been a joy to work with older people, and it's truly been a joy to work at Episcopal Church Home with the staff and the leadership under Beverly Edwards. But what I would like to say about what has happened in the last year and a half or so, I've never experienced anything like this in my life. Being around the families, being around the residents, and what it had, the impact it had on them. I will say, for the most part, to me, the emotional impact. Of course, we have had some people that have passed away from it because this is one of those viruses that's just not letting loose. But the emotional impact on not only the residents, but on their families, particularly the residents, because there was times when we could not allow visitation. And we know as we age, it's good to have that fellowship with friends and family. And so stopping that fellowship caused some of our patients to have increased depression or signs and symptoms of depression because they didn't have that connection with their loved one. They weren't seeing them on a daily basis. Some of our family members come by all the time. So you had that, and then it was hard on the staff too, because let's be honest, we all get attached. If you're in a service type job, there's going to be an attachment. And so to see not only the residents hurting, but their family, and experiencing and internalizing this day and day, and you're not getting a break. You know, we're not getting when it first hit, we didn't get a break to grieve. I tell my family, I didn't have time to grieve. It was one after another. It was nothing that we did. It was just that the virus was just coming in, and it was like just sweeping through. It's nothing that we did, but there are things we can do to help going forward. So I hope this conversation is welcoming to some who had some resistance to the vaccination. They have a clear understanding that it impacts us all. and it impacts our patients too.
Thank you for sharing that.
Thank you.
So we're going to move on to immunity. And I have a question in here, Felicia, I was hoping you might take. If someone had previously tested positive for COVID-19, say maybe mid last year, even in the midst of COVID through 2020, do they still need to consider receiving the vaccine, or does that afford them some type of long-term immunity?
Thank you, Joan. Also, thank you to the Episcopal Retirement Homes for having me. In regards to natural immunity, that's what we call it. Basically, when your body's introduced to the COVID virus, you build a slight immunity to it. Really depends on your symptoms. So it really depends on how mild or severe your symptoms are in regards to building your army. So when you build your army, it really just depends on if you really had a mild symptom, which you build a small army, or if you had a severe infection, which you build a larger army. Still up in the air in regards to how long it may last, because it varies from person to person. So that's a natural immunity. And what the key thing is that you have to survive it first. So that's the key thing. People say, hey, just let me grab, give me COVID. But it's like, it's still questionable in regards to if you are going to survive it. So with the vaccine, it gives everyone the same dose. So you get the vaccine, then you build an even stronger army, because science has proven that it gives you a certain amount to build in your body and build you that army. So in regards to a more robust amount, larger army, that's what the vaccine delivers, versus natural immunity, where it varies from person to person. So you still need the vaccine.
I love your analogy. Thank you. So moving on to distrust, Renee, I would like to ask you this question. We know that throughout our history as a nation that there's been and still is a large racial disparity in our healthcare systems. And it's what your organization does on a day-to-day basis. For many people, there is a lack of trust of the vaccine because of this. And I'm just wondering if you can talk to us about what you've seen, how people have balanced this kind of honest hesitancy with deciding to receive the vaccine.
Renee, you're on mute.
And all the time.
Thank you for
unmuted
doing
now.
that, so I wasn't the first one. Thank you.
Well, first of all, thank you to ERS and Laura and Joan for inviting me to this conversation. It really is a conversation. We've had over close to 40 town halls with these type of conversations, so that people can ask questions. The reason for the hesitancy or concerns is that there have been decades of research that has been conducted in our community, specifically the Black community, without knowledge of individuals. And so that knowledge and that generational conversation about that history is what you hear when you hear mistrust, right? And so when you start looking at healthcare delivery, and today, people are oftentimes, from research we've conducted over some years now, don't necessarily feel heard, don't feel that they're truly trusted and valued, and often feel judged. And so now you flip the script and we have a virus that is disproportionately impacting Black and Brown people. And so the reason for that mistrust then becomes a further conversation about mistrust. But what we now know is the percent of people that have taken the vaccine, and the vaccine outreach events and conversations we've had have resulted in people seeing their friends, their families, their siblings, their children be okay after getting the vaccine. Also now, we're hearing that, we have and I may not say the statistic right, but those instances of people who are now in our ICUs are a majority people who are not vaccinated. And so those are facts. And so what I have done, what Commissioner Moore and Dr. Edgy and many of you on this call who are continuing to serve our communities, is that all I have to do is tell you the facts, right? I can tell you the facts of how many people have been vaccinated. I can tell you the facts on how many people who have lost their lives or have long haul impact of COVID-19. And so it's those facts that help, I won't say mistrust goes away, but helps people better understand that, okay, these are the facts. This is what is happening. I know someone who died from COVID. I know someone who got the vaccine and they're fine. And so I think it's those conversations and the communication, and unfortunately, mistrust is further exacerbated by misinformation in what I call our social media doctors. And I am not judging. I am not questioning anyone's tactic or reason that they share information. That's what we do. If someone tells us something, someone's going to snip a piece of it and share it. It doesn't give you the entire context, right? And so I think this conversation and this conversation of mistrust, that mistrust has not gone away. But I think the facts and the experiences and having a peer, a person that you trust, tell you that it's okay and I'm okay and I'm here. So I guess that's my long-winded response to the question about mistrust. Yes, mistrust of the healthcare system, mistrust of many systems, as we have now seen during this time, as we have this bigger spotlight on racial inequities and structural and systematic racism, right? So the conversation has to be had. And I think when people get facts and they can see for themselves, that's how we then don't have to talk about that conversation of mistrust, but more, here are the facts. And you know, what I'm hearing now, we have been a part of all types of vaccine outreach events with Commissioner Moore and her team. This Saturday, we had shots at the shop, and there was an older gentleman who was a little reluctant at first when he came in. And when he got the shot, he said, "Oh my God, I got the shot." He was so excited because he was fearful of whether or not it was going to hurt. Like all of these things that he'd heard, like were, you know, but he got it. And he was like, we all like cheered. You know, that's what it's about. It's about, you hear meeting people where they are. I think at this point, it's about making sure that the vaccine is where people are already going so that it is easily accessible and that we provide information, we answer questions. If someone's answer the question, provide the facts. Thank you.
Thank you for your perspective. Really appreciate that. So, Dr. Moore, you know, although we know that we remain in a public health crisis, we have at times seen COVID-19 politicized. And I'm wondering, in your role as commissioner, how have you seen our local, state, and federal politics impact one's decision for or against receiving the vaccine?
You know, yeah, I've seen what can occur, right? And for me, what I gravitate towards is the positive. And through this entire pandemic, if I use all of these boxes that are filled with all of these faces on it, that's what I saw at the local level, the state level, and the federal level, right? People coming together that would normally not come together. You know, we talked about all of the telephone calls that all of us were on, and still trying to make sure we got that messaging to the right people. But what I heard, what I saw was collaboration. I saw and I heard questions about, how's it going? What are you doing? and sharing. I remember seeing something and I had to share with President Mahaffey Harris what I saw. And she took it and put her local slant on it. And it was about the doctors talking about the efficacy and the importance of getting vaccinated. I remember, it seems like so long ago, but in the pandemic, what you guys didn't see was President Mahaffey came over here to my office and we planned. First it was, I said, I want to do 90 days. She said, no, Commissioner, no, we're going to do 30 days. We're going to have a 30-day plan for testing. So we were midway through the 30 days and I said, we need a 60-day plan. And then we got through the 60 days and she said, Commissioner, can we go do this one and can we do that one? It became a 90-day plan. And I needed her. I needed her because I was getting hit with this stuff, this information, because I think Dr. Usher said, never been in a pandemic before. And you're hit with all of this and you don't have time to sleep. You have to think. And you're constantly thinking, okay, how do I put this together in a package with a bow that will be important for people, while at the same time educating all of ourselves. You know, I remember we were appointed, Renee was appointed to the governor's task force. We're in the middle of something and I shared with her, I felt convicted because I was standing up at a press conference talking about the numbers of this and this and this and this, but I had missed my brown community. And I felt convicted that I was thinking, they must think I don't care, right? But it wasn't that I didn't care. I didn't have the data that I needed, right? So it was Mahaffey Harris on a conference call that the governor had put together, and we were talking about the data. What do we really want to see? So what I saw was partnership, collaboration, and people filling in. You know, yeah, there was a lot of noise going on, but we had to remain focused. And the other thing that came out of that, out of this collaboration, and I saw it again today, we need to be kinder and gentler. I saw that. I had a health commissioner put that as her tagline. So those are the things that I saw. Of course, there's always going to be some negativity some kind of way, but it's left to you to be able to lead and lead in a way that you can convince your community that we're doing the right thing. And the noise kind of gets silent. We silent the noise and the negativity.
I love that. Thank you. And couldn't we all benefit by having that as our tagline, to be kinder and more gentle? So thank you for sharing that.
Certainly.
So moving on to personal freedom. You know, some people, and Felicia, I'm going to ask you this question. Some people believe strongly that their personal freedom as an American is being jeopardized by considering the COVID-19 vaccine. And, you know, we've seen stories on the news where, you know, people have admitted they had to sneak to the pharmacy to receive their vaccine because they didn't want their friends or neighbors to think that they were giving in. And I'm just wondering, have you seen this in the work that you do? And how would you respond to someone who feels this way?
Yeah, it's unfortunate just because society drives the negative and the positive, as Dr. Moore has spoken to. But I believe we have to shift our focus and our mindset in how we make really decisions. So the decision is, are we going to do it for other people's or for ourselves? Are we going to do it for just, and people really correlate this to freedom and power when it's really about humanity. So I feel like we have to do our part to help others and ourselves. So for me, it's more about changing the shift in the mindset to not freedom, but it's what can I do for other people? It's not about sneaking away. It's not about you no one's taking any power away. It's not the power, it's health, it's humanity. So again, shifting the focus and shifting the mindset. So we're able to see the bigger picture, and not just for ourselves, but for other people.
Great, thank you. Renee, I'll end kind of our last prepared question with you before I ask you all to answer a question. But in the work that you do every day, what have you seen as some of the greatest barriers? As you and your agency has been out so diligently working in our community, what's helped those individuals on their journey to go from not receiving the vaccine to deciding that they do want to be vaccinated?
Again, I did it again. I heard you asked me two questions, it seems. One was about, what barriers did we see? And I think early on, the barriers were confusion, barriers to information, barriers to transportation, barriers to access to the vaccine, access to COVID testing. And so, as Dr. Moore shared, we not only looked at the COVID, we saw what worked well in increasing the number of people that were getting tested. So it's like the data's here. We know where people live. We know what the factors are. Let's go ahead and map that and make sure that we then figure out how to get to those places. And so many partners and collaborators made that easy, so that we could simply be able to work with our health departments and our hospital systems to stand up sites where people already were, where we knew there was greatest vulnerability, or when I say vulnerability, I mean accessibility, right? Transportation is a barrier in our region. And so I think as there was a greater outswell, and I will also have to say, the campaign that evolved out of research we conducted for Hamilton County, that campaign was called We Must Save Us. And I think as Felicia talked about, and I think this conversation about humanity and grace to each other, and really recognizing that we, no matter who we are, where we are in the spectrum, there is a reason that we may have a question. And so if we can remove the barriers to being able to ask that question, and then figure out a way to meet people at the places they already are, as though we are really working to adapt ourselves to you versus asking you to adapt yourselves to us. I think that's where things shifted. I think, yes, people were hesitant in the beginning, right? They had lots of questions, but we provided information. We provided information where people were. When people asked me, well, why are young people so not sure? I said, well, first of all, I'm not a young person, not that young anymore. And so I said, we need to ask them, and we need them to decide what it should be that they want done. And that's what happened. So when you talk about collaboration, man, there's been some incredible collaborations uniting in ways that we never would have. So I am very hopeful. I'm seeing that type. Actually, I was on a call about an hour ago where I said, hey, are we going to still have a drive-up event at this restaurant in Walnut Hills? And they're like, yes, people keep calling me and they want to know where they can get the vaccine. So all of our persistence and our resiliency, so it is about us taking care of each other. And I think we're seeing these increases of COVID cases for our kids. And I think we're now saying, you know what, this is about humanity, as Felicia said. This is about what we need to do together, so that we can get to whatever that new better is going to be for us.
Wonderful, thank you. Thank you. Well, one last question for all of you. And then we're going to go on to a few questions that have come in since we've been talking. I'm hoping, Dr. Edgy, you might start. And the question to all of you is, tell us your why. Tell us why you personally decided to receive the COVID-19 vaccine.
Absolutely. Thank you for the question. being a physician, taking care of folks, from birth all the way to the grave, I wanted to make sure that I had a credible voice to ask folks to take the vaccine. And so that catapulted with the death of my stepmother. She actually passed away in August this time last year. And since the Moderna trial is here at UC Health, I figured, you know what, I can be a part of the solution. And in the process of doing that, I can speak to patients with experience. I read all up about mRNA and the dangers, that I didn't find any, and wanted to make sure that, it was going to be safe. And so I went ahead and did that. I'm still on the trial. This is trial day 346. I'm going to be staying in for the full 25 months. They take 8 vials of blood from me every several months to make sure my immunity is still up. So that was my reason for getting vaccinated. And I didn't find out until Insurrection Day that, I had actually gotten the vaccine itself. I had some side effects on the second one, just a lead arm. So I pretty much guessed it wasn't placebo, but that was the reason. And subsequently, I did end up having 3 more people in my family die before the EUA for Moderna, but nobody else in the family has been lost since then. So it has just been an important thing for me. I also take care of the education of 700 physicians in training. And before the Moderna EUA in December, we had about 56 that were positive before we had the vaccine available. And since then, none until just real recently with 5 broke through with Delta. So
sorry for your loss, and thank you for sharing your story with us.
You're welcome.
Felicia, what is your why? Tell us why you personally chose to receive the vaccine.
Yeah, multiple components. Personally, it was a mission of mine to, I would say 80%, 20% to protect myself, but 80% to protect other people. I would have been devastated if I was the one that would have caused any of my family members or close friends to actually become hospitalized or sick. I feel as though that I have to protect myself to protect others. There were 8 family members that were positive in my family. One I had to send to the hospital, and the fear of the unknown really scared us. But then also professionally, I knew that I see the outcomes. So not only do I work as a nurse practitioner in the outpatient world, I'm a nurse in the emergency room as well. So I see it from both ends. I see it from the unvaccinated that have not, gotten their vaccine, who's 35 and cannot breathe and is now on a ventilator. And I see it from both spectrums. So for me, it's about protecting people from all facets, because I see it from both ends, from death. And it's not pretty. It's not pretty because it impacts everyone around them. I know that with COVID, with long haulers on top of missing work, meaning that, you can't have a paycheck. That means you can't pay bills. So all of these things are just a snowball effect on a prevention side from a nurse practitioner aspect, but then also as an emergency room working in there, you see the survival piece too. So for me, it is all about encouraging people to protect themselves, and so we can protect everyone around us.
Thank you so much for sharing that. Renee, would you go next and answer that question?
Or, well, I guess I never thought about not getting the vaccine, so to be honest with you, because I was out in the field a lot with people, and I said, and everyone around me kept saying, well, should you be out that much? Should you be doing all these things? And I'm like, well, I have to. We have to get information to people. We have to help save lives. And so I lost an uncle to COVID, and once the vaccine was available, and Commissioner Dr. Moore can attest to this, I would call him, I'd say, I call the people at the state, okay, so when is my age group going to be eligible? And so, early on, I couldn't see my parents, and last August, my mom died from a rare disease, and, I just wish I, had the vaccine then, so I could have been with her more. And so there was no doubt in my mind, after, that difficult experience in my life, that I was ready when I was eligible to get the vaccine, and everyone in my family as well, including my 15 and 16-year-old nephews. So it was just what we felt we needed to do to protect each other. And my daughter in college, her friends decided, we could be able to be together if we all got vaccinated. So I thought, wow, that is awesome. So anyway, it's always been positive for me. However, I do understand that there's a lot of information that has been floating around with folks, and it causes, to kind of question. So I said, tell us your questions. Let us give you information so that you can make an informed decision. I am not going to make you do anything, but I want to make sure you have information so that you can make sure you do an informed action that is helping yourself and your family. Okay.
Thank you so much for sharing your story, Renee. Dr. Usher, same question to you.
Mine is twofold. Like others had said, personally, I'm in healthcare. I understand the science. So I wanted to protect myself. And I believe in vaccinations. We've been taking vaccinations for many years. Since birth, we've been taking vaccinations. So I believe in the science. But also, the second fold was love thy neighbor. And I wanted to make sure that I was able to visit with my parents, which my immediate family, we all were vaccinated. We all took this stance that we're going to do the right thing. I wanted to also be able to be with my patients and protect them. And so I think for me, it was, I have to look forward to the future and what can I do to help the future? And I needed to be a part of the solution and not really part of the concern or the issue of the problem. And I think if more people looked at it that way, it's just not a personal choice. It's the right choice to help others. And if we start respecting the community and loving one another, I think we see it that way. I know there's some concerns, and you have the right to be concerned, but I always tell people we eat food. We don't all have a farm. We don't know what is in the animals or in the vegetables that we're eating. We take medication if our doctors tell us we have high blood pressure or high cholesterol. Do we always read the fine print? And we take those things. And so with the COVID vaccination, it was the right thing to do. My mom was recently diagnosed. She was vaccinated, but my mom has Crohn's disease, and I'm happy to share that. Her immune system was not what it needed to be. So the booster just came out. But I think it's very scary to think of, had my mom not had the vaccination, what the outcome could have been for her. And so I'm thankful for the scientists. And I will stand at the roof, on the top of a roof, and say, take the vaccination. It's the right thing to do. It's not a personal decision. It's a community decision. It's the best decision.
Wonderful, thank you. And Dr. Moore.
Certainly. So first, it was my family, because I wanted to see my family because they're not here. Second, my community, and my community are, when I think about my role here in the health department, is my employees. To model the behavior that I want to see. And then early on, the town halls, I don't know if Renee knew this, but with all of the town halls and all the times you asked me to be on those virtual calls, that was my education and reading. As a public health professional, I am supposed to promote the public's health and prevent. And I believe in that. But it was the community, you know, we heard about those trusted voices. So if I'm a health commissioner, I guess I'm considered a trusted voice, right? So I need to be able to say the why I did it. It was my family, it's my community, and I wanted to model the behavior. And the bottom line, I did not want to be hospitalized in a hospital going through, you know, I kept having these images, Dr. Ursher, when we were talking on those calls about the senior living facilities. I would have been fit to be tied in a hospital bed, and I can't have anybody in that hospital to visit with me. You know what I'm saying? So I thought about all of that. And then I didn't have time. I did not have time. It was about stay focused on what you need to do to stay healthy and model this behavior so that you can be that voice to talk to other people. And listening, really listening to what others were saying and kind of weighing that against what I was thinking. And I said, still, don't want to be in the hospital. I have to take the vaccine. I read the science and I believed in it. We knew what COVID can do. We know.
Thank you so much for sharing that. And thank you to all of you for sharing your personal why with us. It's really very impactful. Thank you. So we have had a couple of questions that have come in our time together. And the first question has to do with pregnancy and breastfeeding. So it looks like on the CDC's website, it says as of August of 2021, there's not enough data to decide whether or not one should receive the COVID vaccine during pregnancy or while breastfeeding. So I'm wondering if one of you would take that question, maybe Dr. Etchie, to you. Oh, you're on mute.
Following Renee's lead. So basically a couple of different things about pregnancy. Usually in trials, we don't enroll women who are pregnant for fear of, causing harm to a fetus and so on. But of course, nature happens. And so in the Moderna trial and in the Pfizer trial, people inadvertently did get pregnant. So we actually have data on 140,000 pregnant women, and we have had no losses. We've had no fetal malformations. We haven't had any of those things. And that makes a lot of sense for a couple of reasons. mRNA is something that comes in, it's injected into your cells, but it is completely distinct and different from the DNA, which is, let's say, another blueprint to make a Lu-Edgy. That blueprint to make Lu-Edgy is stored in a safety deposit box in the nucleus. And there's absolutely zero access of the mRNA from the vaccine into that safety deposit box. So for that reason, we don't see any changes. We don't see any abnormalities in babies that are born to those 140,000 women who've gotten pregnant over the pandemic and were in the studies. Additionally, we do know that the antibodies that the mother makes cross into the blood. They're found in the umbilical cord blood and breast milk, and they are protective to the newborn. And so if you think about that, but then you think about an unimmunized pregnant woman, unimmunized pregnant women are 3 times more likely to be in an ICU. They are much more likely to have a tube down their throat to be on a ventilator. They're much more likely to have long-term side effects and have issues happen with their baby. And so the American College of Obstetrics and Gynecology and the Society of Maternal Fetal Medicine both have recommended that we go ahead and vaccinate.
That's great.
Great. Thank you so much. Thank you for that. Another question came in. Does vaccinated individuals transmitting the virus, meaning if someone has both doses of their Pfizer and they get COVID-19, are they at the same risk of transmitting that as a non-vaccinated person? Is the transmission rates similar or are they different? Anyone want to take that?
I wouldn't necessarily, I'm not going to give you statistical numbers because I don't have that in front of me, but what I can say is, and I'm just talking from a personal perspective, you know, my mom was vaccinated. She received the Delta variant. So as we know, viruses are not like bacteria where we identify a bacteria source. We know what antibiotic will work on that particular bacteria. And so we're able to treat it. Viruses are really smart puppies. They can figure out, oh, I'm in this body, I'm having a party. And then they go to another body that has the vaccination. It's like, oh, I haven't, you know, and your body recognizes that they haven't seen this virus because that's what your immune system is supposed to do, fight it. Haven't seen this virus before. But then the virus is like, I'm gonna have to change up my skirt or my dress because in this party house, it's a little different. And so I say all that to say, can you be vaccinated and get the Delta variant? Yeah, you can, because it's mutated and it's changed the way it looks. It's changed its style of clothing and you can pass it on to someone. Now, if someone is vaccinated in my mom's situation, I'm not saying all that are vaccinated to get the Delta, that they may not die. But in her case, and she was suppressed, immunosuppressed. In her particular case, she had the vaccination, so that helped. She wasn't 100% because she needed that booster, but it helped. So you can pass the vaccination, the variant, from one person to another, even if you're vaccinated, because it mutates. So that's why we're talking about herd immunity. And that's why we're pushing for people to get vaccinated and wear their masks so that it doesn't have all these different parties to go to and changing outfits to and jump in different bodies. Because if we slow down the partying, then hopefully we can eradicate this particular virus. I hope I answered your question.
Good analogy.
Mm-hmm. And another one that came in through the chat feature is similar. It is, if I receive the COVID vaccine and I can still get the virus, but will I get the virus to the degree I would get it if I am vaccinated?
If you're vaccinated and you end up with the virus, the outcome is a little different, meaning hospitalization and death is not as high to occur. And that's why we want people to get vaccinated. And if you notice with the cases that we're seeing now, the Delta variant cases, as Renee mentioned, large percentage of those cases are people who are unvaccinated. Ergo, they're in the hospital, they're hospitalized and they're having severe illness. So that protection, I like what Dr. Usher said, like the party and the dresses. I like that.
I like that too. It's a lot of good takeaways from today. Another question, with the Center of Medicare's decision that all nursing home staff will be required to be vaccinated, will all nursing homes have to follow this?
I can take that, Joan, because that's a very industry specific. So, and it's evolving. Leading Age National is working with CMS. There's an advisory committee that Katie Smith Sloan, our industry president, is working on. And the nuance there is that, and don't quote me on statistics, but you know, the mass majority, 98%, I read a statistic one time, of nursing homes across the country accept Medicare and Medicaid funding. And so CMS, when CMS is mandating, and the president has said all nursing homes that received, if you read his report very closely, he said all nursing homes that receive Medicare and Medicaid funding are going to be required. There are a handful. There's one in our local area outside of Dayton that still has a nursing home that's 100% private pay, but that is really very, very rare. I think serving on Leading Age Ohio, I want to say that there may be 3 or 4 in the entire state of nursing homes that don't receive Medicare or Medicaid funding. ERS, of course, does. And at all 3 of our campuses, we receive Medicare and Medicaid funding. So we would be subject to that mandate. When we received the news of that, of course, it was a non-event because we had already several weeks before announced to the world and have been talking about with our staff since January, and then formally shared with staff in May that we were moving in this direction. But it's not an all, but it's a very, very high percentage throughout the country. And I'll add to that. You notice that if you've watched his press conference, which I did, and I rewinded it a couple times and hung on every word of Mr. President Biden. He said, and this isn't it. We've heard a lot of criticism in our field that, some other CEOs maybe have said, well, why is he picking on nursing homes? And my prediction, and it's recorded, so we'll be able to go back and see, my prediction is he's not done. He knows that hospitals get a lot of Medicare and Medicaid funding. And I think it's a matter of time in terms of when he will announce that there will be the same kind of restrictions or incentives, if you will, on hospitals. The good news is we live and serve in primarily Cincinnati and Louisville. And I got to tell you, both hospital systems in Cincinnati and Louisville didn't wait for that mandate for hospital systems. They got together, using the word that we've heard all day today. They collaborated. And they've kind of said that this, we don't need a mandate from the president. We're going to do the right thing, and we're going to mandate vaccination in our system. So,
yeah,
great
and
question.
I think that's a really important point. All of the health systems in Greater Cincinnati are making sure that we get vaccinated, and I think that's part of our service to our patients that come in, to make sure they don't come in and catch something from us while they're sick with something else. Additionally, one thing I just want to point out is you think about how diverse physicians are. We have Republicans, we have Democrats, we have Christians, we have atheists, we have Black, Brown, Hispanic, and 96% of us with completely opposing views about all kinds of things are vaccinated because we believe the science. For me, that is really compelling. Regardless of where you are in your spectrum of anything, we all believe the science, and 96% of us physicians are vaccinated.
It's awesome.
Well, I have one more question, and I think it might be the most honest question of the day. I'm going to be honest, I don't like needles. Is there any other option to receive the vaccination without the needle? It's the last question that came in. Yes, Dr. Usher.
So there's no other option without a needle, but this is what I'll say. There's something wonderful called Emla cream. It's lidocaine. It can be numbed. Hopefully maybe you could take someone with you when you go for moral support. It goes so fast, you've blinked and it's done. I promise you. So Emla cream, just blink and it's gone. They're done. And I think you can do it. Take moral support, you can do it.
I would also piggyback, and I don't even look. Just don't look. Don't look at the needle. Don't even look. So just turn your head, take a deep breath, and 2 seconds, you're finished. The biggest thing is to again, shift your mindset about protecting yourself and protecting others. Turn away, deep breath, is done.
There's also a tiny little device called a shot blocker. It's just a little plastic thing that you can put on your arm, and you can actually have them give the shot through it, and it works beautifully. It confuses your skin into thinking there's nothing going on there. So,
Christine.
That is great advice.
Yes, great advice. Thank you. And thank you to all of you. So this has not only been informative, but this has been inspiring. And I'm so grateful that you are each in your roles You're amazing leaders and you're making the world a better place. So thank you so much. Laura, I'll send it back over to you.
Well, it's been a pleasure to be a part of this. As I said, I was so excited waking up this morning knowing I was going to be with you all today and had the opportunity to learn even more about the science and the vaccine and different perspectives. So I want to thank each of our speakers. I know the entire organization, however you feel about the vaccination, is just really honored that these dynamic and experienced women are here with us for an hour. So thank you, all of you, for attending. I love that last question. I was that little kid that was deathly afraid of getting a shot, deathly afraid. And my mom, oh my gosh, she is so old school. She used a lot of the techniques that were shared, but she also used a reward system for my mom, for my sister and myself. And I will just say, if anybody wants me to be with them while they get their vaccine, I will treat them to an ice cream milkshake, because that's what it took me to get over my fear. It didn't get over it, but it sure made the end product sweet. So every time I got a shot and I didn't cry or throw a fit growing up, we were able to go to UDF and get an ice cream. So the offer's out there. You let me know if that would help you, and it'll be my honor and my treat to be with you and treat you to an ice cream.
Great.
Well, thank you all. We appreciate your time. And if you continue to have questions about the vaccine, just please let us know. We're here. Like I started at the beginning, we care deeply about all of you. We want you all to be with us on September 26th after our mandate is into effect. And we value you and the service that you provide to our residents. So if there's any questions that you have, I want you to know that you can reach out to me personally. You can reach out to your vice presidents. We stand ready to help you in your discernment process. So thank you and have a great rest of your day.
Thank you.
Bye-bye.
Bye-bye.
Bye. Thank you.